I believe it's muted.
All right. We've had a couple of hiccups this morning, but as I've said, it wouldn't be Management Forum without a hiccup or two. So good morning, everyone, and welcome to our August Management Forum. We are unbelievably, almost through summer and heading into fall very soon. A lot of stuff in the news. I know we're going to cover and about COVID and about a number of other things. So, Susan, would you like to start us off?
Yes, Brent, thank you. I would love to. Good morning, everybody. Welcome to August. It has been a really interesting time, very busy. I know you all are feeling it, and I know you likely have a lot of questions for our experts who are here today. So without further ado, I think I'll go ahead and introduce Dr. Lisa Winston, who's going to give us the COVID update, which I know we're all eagerly anticipating. And then after Lisa, we'll have Terry Saltz for the building projects, and then we'll have an open Q&A. Thanks, everybody. I really appreciate you all being here today.
Oh, could I just say one quick thing I forgot to mention? If you have questions, please submit them through the Q&A function that's right on your screen, and we will get to them as soon as we possibly can. Thank you. Sorry to interrupt.
Thanks, Brent. Thanks, Susan. Good morning, everyone. So I pulled a few things together for our COVID potpourri this morning, and then would be glad to try to answer questions that you may have. I will certainly do my best. So I think many people have seen that, you know, in the US, we are over 600,000 COVID deaths and over 35 million total cases. Just for context for where this puts us in terms of the world pandemic, we still remain #1 for reported cases and reported deaths. With India coming up second for reported cases and Brazil coming up second for reported deaths. Of course, there are questions about how complete reporting is throughout the world, and that may be influencing some of the numbers. And even in the US, we do know that, you know, many people have probably had COVID with relatively mild symptoms and have not been tested. So these numbers are really the minimum estimate for what has occurred. In terms of where we are with the Delta variant, and I'm sure many people have seen this in the news, you know, coincident with our fourth surge, Delta was making up a majority of our isolates, and now that is even more true. The Delta variant is thought to make up more than 90% of our isolates in most of the US, in some places more than 95%. And so sequencing efforts that are ongoing are really going to be important to see what happens next, and so that we are, you know, prepared for what may be coming after Delta and any changes that have occurred. I'll talk in a minute about what's going on in the Bay Area, which I'm sure is familiar to the folks who are listening today. But of course, the whole country is struggling with the fourth surge. And, you know, really, this is most acute in the city, in some of the states in the South, with particularly difficult challenges in Louisiana, Florida, and Arkansas. And, you know, while we're seeing surges in cases in many places, states in the South are seeing a concomitant dramatic surge in their hospitalization rates, with shortages of beds and particularly ICU beds, probably mostly driven by the fact that the vaccination rates are lower, because of course most of the people who are hospitalized are unvaccinated, and the folks who have the most severe disease in the ICU and all the deaths are nearly all in people who have not yet been vaccinated for COVID. And you know, we're sort of moving into a realm where, although we don't have national or state mandates for vaccines, we are getting increasingly kind of piecemeal mandates. As you know, we have many things going on in the Bay Area in terms of requirements for vaccines, but I think many people will have seen the new announcement that the military will now be requiring vaccines for all personnel there. It's estimated that about 2/3 of people in the military have been vaccinated so far, but there will be a requirement by September 15th for vaccines to be required, which President Biden has now said that he agrees with. And that may actually come sooner if the FDA approves the Pfizer vaccine with full approval earlier than mid-September, as many think they will. The FDA has signaled that they are trying to get through their processes as quickly as possible so that full approval will be coming. So just a few more things in terms of what we know about Delta, and I'm sure many people have seen these reports as well. Delta is unquestionably more transmissible than our previous, the original strain of the virus and the variants that have come after. It's estimated that if precautions aren't taken, that the degree of spread is similar to chickenpox, which is, of course, a very contagious virus. There has been some debate about whether it is more severe than the variants and strains that have come before. I think the consensus is that it is probably more severe, probably somewhat more severe in terms of risk for hospitalization if you have not been vaccinated. But the transmissibility in many respects has been really what defines this variant. However, I think it's really important for us to be heartened by the fact that all of our vaccines are really continuing to provide excellent protection against severe disease, hospitalization, and death. In some other news that just came out this week in Morbidity and Mortality Weekly Report, MMWR, you know, there has been a question of, if you've already had COVID, how much additional protection do you get from being vaccinated? And there was a really nice study that was done in Kentucky comparing those who looking at people who had already had COVID in 2020, and then comparing those who got reinfected and those who didn't, and looking at vaccination status. And being unvaccinated actually conferred about 2.3-fold greater odds of reinfection if you'd already had COVID. So having had COVID gives you some protection, but being vaccinated on top of that really does seem to provide additional protection against reinfection. So where are we in San Francisco? We continue to do pretty well with our vaccinations, but of course, we hope to do even better. As of our latest reports, 77% of all residents in San Francisco have had at least one vaccine dose. 70% have completed the series. And for those who are 12 and older, so amongst those who are eligible for vaccination at this time, 85% have completed at least one dose, which is great. We want it to get even greater, but it's pretty great. And 78% have completed the series. And we think this is the main reason that although our cases have been surging in the Bay Area, that hospitalizations, although they are going up, they are not going up as fast as the cases have been going up. And as of last count, a couple of days ago, there were 97 total hospitalizations in San Francisco. So that's many more than we would like, but not as high as we were during the winter surge. Although the suspicion is that we have not reached our peak yet, and we will continue to go up from there. So what are we doing to combat the surge on campus? As everyone knows, we are continuing to wear masks in any place where we have patients or visitors or research subjects. We're wearing the isolation masks unless we are alone in a private space. And, you know, just a word, this has come out in the Daily Digest, and many thanks to Christina for creating a lovely flyer explaining our policies about eating together. We know that everyone wants to you know, eat together and socialize, but this really is one of the highest risk activities. So we're just really pleased asking everyone to keep your masks on when you're together. Definitely not to eat together indoors, and if you're outdoors, to be, you know, only with 1 or 2 people, and to really keep your distance when people have their masks down. We really want to keep everyone safe. We don't want people to get sick, and we don't want to have any worsening of our staffing shortages that are affecting us here. They're affecting the whole Bay Area, and actually they're affecting the whole country, with some of the parts of the country that are hit worse with COVID also hit worse by the staffing shortages. So thanks for everyone's attention on that. And then the last thing I was going to mention is what is going on in San Francisco with the Johnson & Johnson supplemental vaccine dose. So it was really helpful that the vaccine branch of our public health department, SFDPH, gave us some guidance on what to do if patients, after consultations with their providers, were requesting a supplemental dose of an mRNA vaccine, either Pfizer or Moderna, after having been vaccinated with the Johnson & Johnson vaccine. People who have had the Johnson & Johnson vaccine are considered fully vaccinated. There's no formal recommendation to get a supplemental dose, but patients and providers have been concerned. You know, from the original studies that were done, the Johnson & Johnson vaccine is not quite as effective in preventing infection as the mRNA vaccines are. And there are concerns that this could be exacerbated by the Delta surge that is going on now. The Johnson & Johnson vaccine is similar to another vaccine used in other parts of the world, AstraZeneca. And there are some data, you know, that a single dose of that vaccine may not provide as full protection as 2 doses of the mRNA vaccines. I will just say that the data that are coming out for the Johnson & Johnson vaccine do suggest that it continues to provide really excellent protection against hospitalization, severe disease, and death. So in the setting of this, in the setting of people, you know, requesting supplemental vaccine doses, we have had guidance that says that it is permissible to offer a supplemental dose if it is requested for people who are either San Francisco residents or who have been vaccinated in San Francisco, supplies permitting, and you know, logistics permitting, because the priority is still to continue to give people their first doses. But our health department did not want people to be getting different answers depending where they went, or to be turned away. And so they were, trying to provide some clarity, which I think we all appreciate. And I will, that's a lot. I will stop there and try to answer questions if there are any at your discretion, Brent.
Oh, thank you. So we may be having a technical issue with our Q&A. If you want to submit a question, you can always send me an email directly. I'm looking at my email as we go forward. If the Q&A is not working, please send an email to me and I'll pass the question along. Lisa, I did want to follow up on a couple of issues. First, can you go over again really clearly the guidelines for our staff on campus behavior?
Yes, and others, Susan, feel free to chime in if I am forgetting anything here. But the key thing that we are continuing to do is all staff, patients, visitors, everyone on campus is continuing to mask. And we are wearing the isolation masks or medical masks in any area that is accessible to patients or the public. That is a really important thing that will help to keep us safe when we are on campus here. The other really important thing that we are, we had been on the verge, as we were getting in the end of May and June, before the fourth surge really started, we had been on the verge of relaxing some of our guidelines in terms of, how we meet, how we gather, could we eat together? And we have not actually been able to relax any of those restrictions given the surge. So whenever we are together in indoor spaces, we are wearing masks. We are still distancing from each other if we are having meetings. If it makes sense to have those meetings virtually or remotely, that is another layer of protection that can be provided. We're not serving food at any meetings. We're keeping our masks on. We're using the alternative break site where people can be distanced when they have their masks off. Or we are using break rooms in a way that is staggered, where people can be distanced from each other, ideally with only one person having their mask off at a time. And then we're very fortunate, given that we are in the Bay Area, our air quality is good right now, the weather is nice, so people can definitely take advantage of going outside to eat. Outside is much safer than inside, but we really do not want people crowding together when they're outside. People should still be distancing if they're taking off their masks and not gathering together in large groups.
Thank you. The email seems to be working fine. With just a little bit of encouragement, Brent's email box is filling quickly. Let me ask this question. I know we haven't discussed this today in this meeting, but we have discussed this, and that is some concerns about the hallway around the wellness center and its proximity to the entrance to the cafeteria.
Yes, and I'm actually going to let Susan take that. I think we are discussing this again at Hicks, and there will be, I think, a good fix for that coming. But Susan, do you want to address that question?
Well, I think you just did that. Yes, we have noted the crowding. we are working on a solution to address the crowding, which will likely involve moving vaccination site out of the wellness center once again. And so I guess I'll just say something which I'll likely repeat at the end of this, which is, you know, we are in a time now of rapid change. We are in a time that requires us to absorb a lot of really complicated information quickly. And so I think my advice to everyone is to, number one, really make sure that you're taking care of yourselves and the people around you. And number two, expect change. There are going to be a lot of changes, I think, upcoming in response to this virus. And what I feel really confident about is that we have just an exceptional, compassionate, creative team, you know, writ large at ZSFG, that can respond to all of these things. And so that was a very long way of answering that question, but yes, we are likely going to be moving vaccinations out of wellness center to avoid crowding, but more to come on that.
So Susan, while we have you on camera, what can you say about the policy for unvaccinated staff members, and whether they'll be allowed to continue to work and so on?
Yes, so this is also a topic that is subject to a lot of information. There have been a number of different orders and requirements from the state, from the city and county, from the local health officer, basically all of which are encouraging, if not requiring, people to be vaccinated. Right now, what we are focused on is making sure that DPH employees upload their vaccination status into the city portal. The grace period for doing that has been extended till the 12th, which is 2 days away. So for those of you, most of the people listening here are leaders of one type or another. So the big focus is going to be on getting everyone's information into the city portal. The great news is that I think about 87% of us are fully vaccinated, and that helps a lot. So I think I'll just stop at that because, you know, it's really important, you know, today to get people's information in. Once that information is in, then I think we can expect more and more direction and instruction about what happens after that. But the general message, you know, as Lisa mentioned, from the state, from our local health officer, from the city and county is we are encouraging everybody to be vaccinated because we know that this is the best protection against infection and especially hospitalization and death. So it's all about keeping the community safe.
And speaking of that, and speaking of our employees and vaccination status, will we be getting a list of employees who have not been vaccinated? Will there be a list generated of them?
So we get lists that say whether or not so HR keeps a list of people who have uploaded their information or not, and then people who are eligible to unmask or not. So what we're doing with those lists is sharing them with leaders in the organization to help encourage their people, as I mentioned, to get their information into the city portal, because that is the next most important thing for us to be doing. With respect to you know, what happens after that, I think I'm going to defer to human resources because it's really up to them to lead that. And I know that they'll be providing further instruction to us about what happens after that.
Okay, thank you. Could we jump back to Lisa for a second? And Lisa, the Daily Digest publishes statistics of our COVID positive patients on campus. I guess there have been some questions about whether those statistics are accurate with respect to all the inpatient units, including labor and delivery. Can you speak to how those those numbers are put together and how they're reported?
Yeah. So, and Brent, and Christina, I may need your help a little bit on this because I think that there may be just a slight lag. So the way that we compile our numbers is actually very detailed. And every morning, 7 days a week, ever since March of 2020, there is a meeting where infection control and ID and others actually go through all the patients who are in the hospital who have COVID and help to provide clinical advice and isolation advice regarding all the patients in the hospital who have COVID. And following that meeting, we compile a list of all the patients, and that gets disseminated to the leadership of the hospital, and that is the information that we report to DPH and then gets reported to the state. I think that is the same information that goes into the daily digest, but it may be a day or two behind. But Brent, perhaps you might be able to answer that, how much of a lag there might be.
Yeah, I do think there is a lag, Lisa. Yes, and we usually take our in-house statistics from the report at Tier 4 in the morning. So there's at least 1 day lag there. And to the extent that we have accurate numbers at Tier 4, we present them in the next day's daily digest. So it could be a lag issue there for sure.
Great. And the report at Tier 4 is done by ID or infection control, and that is the same as the report that is compiled. So
Okay.
I think that if people are seeing a difference, it's probably just related to a lag in the data.
Great. So one more question for you, Lisa, and then we can shift to capital projects for now. Lisa, the question is the supplemental vaccine that you were addressing earlier, is that just for network patients, or is it for all SF residents, or what's the population that's eligible for that?
Yeah, so thanks. That's a great question. Thanks so much for asking. Based on the guidance from our vaccine branch at the health department, we are able to offer that to anyone who is a San Francisco resident or anyone who received their J&J vaccine in San Francisco. So those are the folks who are eligible. It does not need to be just for people who are our patients or are in our network. That being said, the outpatient vaccination group is doing an amazing job, trying to manage crowding, manage lines, and manage expectations, because the priority is to make sure that we have enough capacity to give people their first doses, people who haven't been vaccinated as yet. But it does not have to be people from our own network.
Thank you. That's great clarification. Thank you. Shall we go to Terry? I know there are going to be many more questions about COVID, about practices on campus, but can we go to Terry now and hear about all the work being done around campus?
Thank you, Brent. Good morning, everybody. I will be putting up the capital project slides here. Let me share them. Okay, you should be able to see them now. Going to the front slide, this is our August update. I know you've all been eagerly waiting for the August update, and this is it. And the first slide out the gate is about our alternative break site. We have discovered a new and exciting product that is spill-proof, waterproof, stain resistant. It's called concrete. If you've been to the cafeteria lately, you've seen that we've removed we kind of spruced it up, painted areas, and we pulled the carpet up and exposed the concrete, buffed it up, and put a sealer on it. And we're going to give this a shot. There's in the future, I'm not going to say when, but in the future, there's going to be a much larger dining room renovation. So this is the first step in that direction. But I was a little bit skeptical with this approach, but I've learned to like it. It's a cafe rustico now. So I hope we took the barricades down, so the whole dining room is exposed now, and you can see the pictures where we have one of the conference rooms with the concrete floor as well. So I hope you enjoy that. Moving on to the next slide. Third floor rehab project. This thing is so close, so close. We're just trying to get through the fire alarm work. The OSHPD building inspector is requiring us to do a little bit of extra work, and so we are trying to get that completed as soon as we can. We're planning for a transition, so we hope to be occupying the rehab space. It's a beautiful space, occupied soon. We're doing fire alarm testing right now. We have a licensing and training and a whole transition plan scheduled to follow. Once this is complete and occupied, we can start the dialysis project, which would be adjacent to this space. And we've already done a little early work on the dialysis project, but we're going to start it in earnest as soon as this project is released and we can get occupancy. As well as down in the basements, once rehab relocates to the third floor, we will be building out the public health lab. That project will start. On the sixth floor is another project that's darn near there. It's plagued by the same fire issue where we have to hook up extra devices for monitoring purposes to the fire alarm system. So we hope to have this a path through that request completed real soon, and then we can have 6H available as a additional office surge space which will be definitely needed as we get into our seismic project. Security projects that are underway in building 2 will be kicking off by the end of the month. We'll be starting construction in building 2 to create a foyer and create secure areas in the back of the power plants. On the second floor mezzanine, again, I know you guys are really fond of that orange barricade there, but I do believe that the glass is going to be going in real soon, if not this week, next week. It's been inspected, and we got everything going in the right direction now, and you'll start seeing some movement and activity on the mezzanine. Other items on the security list is the campus access restrictions. The latest thing that we've accomplished is we've installed the access control at the Building 25 lobby, the side door. This will allow for off-hour access for staff to Building 25 without having to go through the emergency department. So this will be active. I believe it's active now, actually. So enjoy. Seismic retrofit. We've been dabbling around the edges of this project, but in September it's going to be going on in full earnest, and you'll see scaffolds going up around the building. And you'll please pay attention to notices. There will be pathway changes. One of the more intrusive ones is going to be by the where the M wing, the outpatient wing, is connected to the main hospital building. There is going to be at different times traffic restrictions there where you'll have to be routed around that area. That's a key point, that we're going to be strengthening in the building. So as we move through the building up and then down again, you'll have restrictions on those pathways. The first one that's going to be impacted is going to be behind the pharmacy, 1P area. You'll see that work first, and that's being scheduled right now. We get asked about, what are we doing about heat and smoke preparations? Heat because we anticipate to have extreme heat conditions later in the next few months, as well as smoke from possible wildfires. We are in the middle of repairing our one existing chiller in the power plant. It's being buttoned up right now. It should be back in service hopefully next week. Additionally, we have two auxiliary chillers that we have installed as additional cooling. We have a 500-ton unit that's installed in building 2, and we have a second 160-ton unit, which is being installed along building 3 to combat the extreme heat. These chillers only serve buildings 5, 2, and 3, so it will not solve any heat conditions in the old brick buildings if you happen to be in the old brick buildings. The wildfire smoke preparation, well, what we found in previous years is that our filtration systems get overwhelmed and they need to be replaced, and we need to have a stock of filters on hand. So we have stocked up on filters and we have staged them appropriately, and we plan to monitor the loading of the filtration systems for the buildings and then replace them as required. And then this would not be a capital capital presentation without me letting you know that the parking permits are still available at San Bruno parking lot. Get them while they're hot. They're still available, $104 a month. While other parking options have been going up, this stays at a healthy $104 a month. Before we move on to the UCSF presentation from my friend Ken Humphreys, I do want to mention that there's other work that we are doing in capital projects that you don't see. I tend to highlight projects that are active and that you'll see when you walk around. But additionally to those projects, we have a family health center project that has been submitted for permits. So that's going through a permit review right now. I mentioned that we have public health lab and dialysis is waiting in the wings to get started. We've been working on a design and development of a new psych emergency services. We are working on design of specialty services consolidation, as well as starting planning for an adult clinic, medical clinic, the Richard Fine People's Clinic improvement project. And then we're also, as I mentioned before, working on the chiller replacement project. And we also are working on a child care center project that is in its development stage right now. So those are a few things that we have in the background that we're working on. So with that, I want to move on to the UCSF Research Building and let Ken Humphreys take on the microphone here. Ken?
Hey, thanks, Terry. And if I could share the screen, that'd be great.
Absolutely. I will stop sharing the screen.
All right, that's a current shot of the building, and right now you could see that we're starting the exterior envelope on the first floor.
Ken, we're not seeing your slides.
Oh, forgot to push last button.
Okay, there you
How
go.
about now? Okay, so you can see here that we started the exterior envelope. The first floor is all framed in place. The rest will be panelized system that you'll start seeing in September, flying by crane, 30-foot tall panels that'll be placed. Yesterday, we poured a bunch of the concrete pads on the roof. Next week, we'll be pouring more of those. And you can see that we've stocked the roof with metal studs and drywall to build out your mechanical spaces up there. When you walk by the building and you see all this netting, that's there because they're putting spray-on fireproofing on the steel beams, so it doesn't spray out outside of the building, and it protects the public as well. So that's an easy way to check the progress. They're on the 3rd floor, finishing that up this week, and they'll be moving to the 4th floor. Everything else is actually going on inside, hot and heavy framing, MEP systems. Building's moving fast, so it'll start changing very drastically in the next couple of months. I think that's all I've got, Terry. Any questions?
Thank you, Ken.
So we do have a couple of questions for Terry. Terry, could you talk about that after hours access again, and what its purpose is, and what it replaces, and who would use it, and under what circumstances?
Yes, currently staff are restricted. They have to come in through one of the entrances that we have available for access. And when Building 25 lobby shuts down, they have to go through the security, the emergency room door to get into the building. And so what this provides is an alternative entrance into Building 25 for people who have a badge, an access reader, and it'll be on the east side of Building 25 lobby. It's the side door that we use as an exit during the day, but in the off hours, they'll be used as access into the building as well.
Okay, thank you.
Okay, thank you.
Could you talk about the childcare project and where that is, and just a little general, like what the capacity is going to be, and who can avail themselves of it?
So the Child Care Center is being built over at the CHM building on the lower floors. The program and design is still in flux right now. It'll be somewhere between 25 and 40 students. It will have an infant program, a toddler program, and a preschool program. It's intended to serve SEIU membership first as a priority, and then others after that. It's just in the design phase right now. The current schedule is to be completed either at the end of 2022 or early 2023. There are some programmatic issues that need to be flushed out with our neighbors to the north, or I'm sorry, to the south with the Parks Department, as well as working out a shared play area with the school district. So as we work through those, that will help shape the program and help define the actual number of students that we could serve.
Thank you. One last thing for you, Terry, before we go back to Susan for our Q&A. You mentioned the need and preparation for wildfire season and air quality. Are there any air quality strategies for buildings 10, 20, 30, 40, 80, 90 that we're thinking about ahead of time?
Well, we're very limited in the buildings that do not have any kind of forced air systems. We're going to have to rely on closed windows and wearing your mask, which you should be doing anyways. But the buildings that we do have forced air systems, and some of those buildings that you mentioned that do have limited forced air systems, those are the ones that we're going to be monitoring and make sure that they're working 100% and that the filtration on them is functional and being maintained to maintain the best indoor air quality.
Thank you. Susan.
Hello, Brent. So lots of gratitude to Terry. He and his team are managing just a huge amount of complexity with the building projects, and not just building, but trying to facilitate all of us working in Building 5 while we're building all around us. So I have a huge gratitude for them, and really appreciate everybody's patience and understanding as we get through the next 3 to 5 years doing all of this, the building work. And we'll keep coming back and sharing updates. There's going to be a lot to talk through. Okay, so I wanted to actually ask Dr. Winston another question. And I did give her a heads up because this is a question I think that's been on a lot of people's minds, and it requires a very careful thinking through the data involved. And that is related to these so-called breakthrough infections. You know, we heard about how incredibly efficacious especially the mRNA vaccines and all the vaccines are. Why are we seeing breakthrough infections? Dr. Winston, tell us more about that circumstance.
Yes, absolutely. And I think, as everyone knows, breakthrough infections were very uncommon in the spring. We had decreasing rates of viral transmission in general. And the vaccines were working really, really well to prevent people from getting at least symptomatic infections, in addition to protecting people from severe disease and from hospitalization. If we fast forward to May and the rise of the Delta virus, and then our fourth surge, which really started in the Bay Area in June, we learned something about the way the Delta virus interacts with our vaccines and a highly vaccinated population. So one thing that our wonderful epidemiologists in the Bay Area always remind us is that if 100% of people are vaccinated, then all of your infections will be breakthrough infections, no matter how effective your vaccine is. So that's part of what we are seeing in terms of seeing breakthrough infections in staff and in patients, is that as our vaccination rates rise, no matter how good our vaccines are, an increasing percentage of our cases will be breakthrough infections. But I think that the other thing that we are seeing with Delta, and this is becoming increasingly clear, is that Delta is just more infectious, whether or not you have been vaccinated. And so it's not that the vaccines do not protect against risk of infection. People who haven't been vaccinated are estimated to be 2 to 3-fold more likely to be infected than people who have been vaccinated. But we're not seeing right now those levels of vaccine protection that we were seeing earlier, where it was estimated that they were 95% protective in terms of breakthrough risk and developing an infection after you had been vaccinated. And those numbers are fluctuating a little bit, the estimates, but I think when we do get formal estimates from the CDC and from the state, we're going to see a lower estimate for vaccine effectiveness for asymptomatic infections. That's some of what we're seeing for mildly symptomatic infections. But the good news, as we talked about earlier, is that even though we are seeing asymptomatic and relatively mild breakthrough infections at a higher rate than we would like in people who've been vaccinated, when we look at patients who are sick enough to be hospitalized for COVID, and especially when we're looking at people who are sick enough to go to the ICU because of COVID, and those who unfortunately are dying from the disease, the vaccines are providing outstanding protection against those more severe outcomes. But we have seen a change with Delta compared to what we were seeing in the spring.
Thank you, Lisa. That was really very helpful. I read an analogy from, I think, another epidemiologist saying, if you think about the difference between the initial COVID virus and the Delta variant, think about it, the vaccine like a dam. And with the initial form of the virus, that was like, the normal load on a dam. But the Delta variant is like a big flood. And so you're being flooded with virus and it's spilling around the dam. So the analogy would be that would be more like a breakthrough infection. That made sense to me. I don't know if it makes sense to anybody else, but just demonstrates how infectious it is compared to other variants.
So we have a question from the email chat line. There are employees who would like to get tested to feel more secure, even if they may be asymptomatic. Can they do so here on campus, or should they go to their primary care physician or medical home?
So I will start that, and then Susan may have information to add. In terms of prioritizing, what we really need to do, I think as many people are aware, occupational health has just done a tremendous job. I mean, they have really stepped up. They're getting, hundreds of calls that they need to respond to try to decide who, needs to be tested, either because of symptoms or exposures, managing getting people back to work as quickly as possible. And the logistics of offering, asymptomatic testing on campus is just, not something that we have been able to do when there has just been real prioritization for making sure that people who either have exposures or who have symptoms get tested. But there are multiple avenues that, people can pursue now. There are COVID testing, remains without charge, either through, primary care. There are public testing sites where people can go. And then, of course, there are now over-the-counter tests that, people can use if they want to test themselves at home. And those tests are really pretty good. So, I wish we could do more testing, but we're really trying to prioritize the things that are the most critical. Susan, is there something that you would like to add to that?
That was really perfect. I will say, in the category of things that are going to change as we roll out our response here to the state and local mandates, we're going to be developing a system whereby any worker on the campus who is unvaccinated will need to be tested twice a week. So that's going to further add to the burden of our incredible OHS team, and they're working on how we're going to implement that at this time.
Thank you both. Could we talk a bit about again, go back to this idea about visitation guidelines just for a bit. And I know, again, this is a moving target, right? And things change as conditions change, but could we just kind of lay out in just the minute or so we have left what those guidelines are at the present time?
Yeah, let me just take that one. And this will be very quick because there's going to be a lot of information coming forthwith. We haven't quite figured out how we're going to operationalize this, but there is a state health order that goes into effect tomorrow that requires visitors to the hospital. And again, our understanding right now, this may change, is that this applies to the acute care hospital. You must either show proof of vaccination or a negative COVID test within the past 72 hours. The only exception to that is end of life. So anybody can just think about that for a minute and think about how complicated this is going to be to operationalize. We have a team led by Anna Johnson that is feverishly working on how we're going to operationalize this. So I would say that this is in the category of please stay tuned. You will hear a lot more about this within the next few days, but know that our current visitation policies are going to change pretty dramatically.
And we will have some guidelines on what staff can do to offer to patients and their families, right? We'll have some
Right.
guidelines about that.
We'll have some advice and guidance about that. Yeah.
Susan, would you like to close?
Yes, I would love to close. And I will close by saying, by expressing a lot of gratitude and just giving 2 pieces of advice again, which I gave previously. We are in a time of rapid change. This fourth surge really, to me, feels different than the previous 3. There are a lot of things about this surge that are different. And Lisa, I think, spoke a lot, very eloquently about many of those differences. And so right now, we're all going to be experiencing a lot of change. So please expect change. Please expect things to be confusing and ask for clarification kindly and patiently. And then I would also just say, please make sure you know what you're doing to take care of yourselves, take care of your family, take care of your teams. And I really appreciate everybody's resilience and compassion and creativity through all of this. So thank you. If you have more questions, please send them to Brent or I. We'll get them published somehow to you, maybe through the Daily Digest. I know there's a lot coming up and want to make sure that we're as fully informational and transparent as we can be about that. So thank you, everybody.
Thank you. We'll see you in September.